A team of South African academics has just concluded the first academic review of government's response to Covid-19. The review was done through a partnership between the South African Technology Network and the national scientists and organizations. The report looked at the level of policy preparedness in South Africa before Covid-19, the interventions to deal with the pandemic and the necessary regulations, infrastructure and policies needed for economic recovery post the pandemic. The Associate Professor at the Wits School of Governance, Professor William Gumede, was also part of the team that grappled with these issues, and he joins me now via Skype for more on this. Professor Gumede, a very good evening to you. Thanks for joining us. Welcome to the Globe.
Evening, and thank you for bringing me in.
Now, what came out of the finding by a team of academics that sought to review the government's policy preparedness for Covid-19? What were the sticking points?
Yeah. Essentially, we brought academics together, from a number of universities across the country, from medical side, to our social scientists to review. So the first thing that we found was that, the World Health Organization already in 2006 warned South Africa and many other developing countries to prepare for flu-like, influenza-like kind of epidemics. But unfortunately, South Africa did not prepare capacity ahead of it, even though we were warned already in 2006, which just means that, when COVID-19 came, we were not prepared as other countries like, let's say, South Korea, Singapore, Taiwan, and so on. Although, we were also, like them, warned already in 2002 to be prepared. Now, for us, the key findings really is, the first phase, there were some good things. And I'll start with, the good things that government focused on in the early response. I think it was very important that government use experts and to help it with its COVID-19 policy. Secondly, government also use evidence-based policy rather than, just ideological or arbitrary type of policies. Initially, also at the beginning, government also communicate well. We saw the president addressing the nation regularly. We saw the health minister, William Gumede, traveling around the country, going to hotspots, talking to the country, talking to the press, talking to the public, and so on. So that was really important because if you think about it, before COVID-19, government really engaged with the public, really told the public, why it comes up with decisions. And then fourthly, also what we saw early on, with government's response, it was also more common sense, more, pragmatic, common sense approaches, practical approaches. And then also, we've seen early on a better partnership initially between, government and the private sector.
Well, Professor, you just reminded us that back in 2006, the WHO urged every country, developed and developing countries, to come up with concrete national influenza plans to deal with whatever pandemic that may come their way. But 14 years later, we're still yet to see those written plans. So what is your analysis of how each and every country, both in the developing and the developed world, are grappling with this virus? Is it really the preparedness or the lack of preparedness, or is it simply because COVID-19 is just too magnanimous and overwhelming us in a way that nobody has ever imagined?
No, if you look at the countries, I'm going to, if you look at countries that's like us, so let's say a like for like, more peer-reviewed countries like our country, let's just say the South Korea and so on, they're really prepared. They also had a crisis. If you remember early on, they had what was called SARS and what was called MERS. So they had, epidemics before. What they did is they really built up their public sector, the health capacity. They build up the expertise. They did research, and they also prepared the economies also, for an onslaught from a epidemic. The same with countries like Singapore. They've done the same. So really, from our side and from a South African side, unfortunately, there hasn't been enough political will initially, or there was not enough priority for a coming epidemic. You must remember between 2006 and now, and just before the previous elections, there wasn't really much leadership in South Africa, from a president downwards.
And this study came up with very pertinent questions as to where are the gaps in our policy, regulation and infrastructural readiness to manage this pandemic. And I suppose that the team has really grappled to come up with those answers.
Absolutely. I mean, the first thing is very, very important that since we don't have as much capacity in the public sector, that that the public sector partner with the private sector, with civil society, and with communities. In that way, we then mobilize the capacity around the country and so on. So that's very important. The second level that we must continue to focus to use evidence-based policies. We cannot just, or the president or the health minister or any cabinet minister cannot just come up with any policy without it being evidence-based. So that's going to be important going forward, that we do that. Then what we need to look at, we have to have better plans. How do we deal with things like social distancing in public transport, social distancing in public spaces, in schools, and so on? Because South Africa, unlike, say, Taiwan or unlike Singapore or South Korea, we've got large informal sectors. We've got informal transport. Our public school system, is in a crisis. It's very difficult, to do social distancing. But still, we don't have a plan from government. How are we going to do it? Of course, it's not very easy. I mean, countries like India is also struggling with social distancing in informal public transport. Brazil is also struggling with it. But we're really going to have to deal with that issue. Otherwise, the spread of the Covid-19, we're really going to reach really high levels. Then also policy going forward must really be based on common sense. Think about this, government, for example, early on banned tobacco, cigarette sales and so on, but there was no explanation to the public why is it happening. So government must communicate and tell people, why they make decisions. And then it's going to be very important, from an economic point of view, that we get food to people who need it, and that we get, unemployment grants to people who need it, and also that we get grants to struggling businesses on time. And there we will again need the private sector, we will need the civil society to help government, and we will need communities to help government.
You just touched on the social elements of how we deal with this pandemic, such as the social grants and the social well-being of each and every citizen. As a matter of fact, this leads to my next point by Michelle Bachelet and Philippa Grandi, the UN High Commissioners, who cautioned that how we respond to the many challenges posed by this pandemic must be grounded in the realities of people's lives and focused on eliminating the barriers people face in being able to protect themselves and their communities. Correct me if I'm wrong, Professor, but then I suppose that governments, not just in South Africa, but the world over, are really struggling to strike the balance between preserving lives and protecting its citizenry from this pandemic. And of course, just opening up economic activity. Like here in South Africa, for instance, the government has been severely criticized that how on earth is it able to open up the economy when we are flirting so dangerously close to the peak of this pandemic?
Absolutely. All of the countries are struggling with this issue, and particularly developing countries like South Africa and India and Brazil, where you have, large informal economies where, the majority of people are in the informal economy, very, very difficult. Public health systems are not working properly. The public schooling systems are not working properly. So it is going to be important that what we do is that there are ways, as we open the economy, that we really deal with the social distancing. That's going to be really important. Unfortunately, so far, we haven't had real answers from government in terms of how to deal with social distancing in public transport, in the taxis, in the trains, and in the public schools. The universities may also return. How do we do it? We haven't done that. Then also, the business must also come up with, how they're going to do safety measures as people get back into the economy. We are not seeing transparent enough plans. But also going forward, it's going to be very important, and we recommend, as a review team, that the social grant must continue government must continue for another year at least after COVID-19, to soften the impact of the economy, of the economic difficulties because of COVID-19. We have to do that. And then we also have to do much more, to deal with vulnerable women, gender-based violence, and so on. We're absolutely not doing enough, to deal with that.
Yeah, sure. And respect for human rights across the spectrum is also fundamental to how we deal with this social pandemic. And as a matter of fact, you are aware that today is World Refugee Day. And just a couple of days ago, the court here in South Africa has ruled that the Social Development Department's decision of excluding some refugees from benefiting from the social relief grant is absolutely unconstitutional. I mean, this is not a time, Professor, of alienating certain individuals from, benefiting from some social incentives.
No, absolutely. I think we have to look at everyone who's vulnerable and who's in the country, and we're going to have to help people. Otherwise, our crisis is going to be bigger, because the problem is if we don't help people who are vulnerable, we will increase the spread of the disease, because then people won't confine to, or they won't comply to lockdown rules and so on, because they're desperate. They need to eat. They need to find money. They're desperate. That is why we really have to look after the poor, no matter where they come from. If they're here in the country, we have to help them as we help every person who's South African and who is poor. But I mean, the big issue is really how to get the money to vulnerable people in South Africa on time, how to get the food to them on time. And unfortunately, the government is just not using civil society capacity and the private capacity, to help. I mean, last week there was, or early this week, for example, there was a debate about that schools are now not getting food. Poor schools, children are not getting food. Now that is unacceptable. During this crisis, and the schools, children are returning to public schools or to all schools, it is going to be very important that the meals that they get, that it should be continued. It shouldn't be discontinued, as is the case now at the moment.
The question you just asked, how do we get the social grants to the recipients on time, I suppose then will be and should be addressed by taking a look at how should the country stimulate the economy again so that we are on a much better footing and trajectory to be much better placed to deal with the social elements.
Yes, no, essentially, we've given a couple of proposals on how to deal with the economy. One of it is to focus on the legacy problems that we have. Remember, we've got a housing shortage, we've got water infrastructure shortage, we've got transport shortages, we've got general infrastructure shortages to rebuild the economy based on, rolling out housing, rolling out water, sanitation, and so on. So really almost focusing on, the lack of previous delivery, for people. So that's the first part of the economy that we have to look at. The second thing is, what we've seen during this crisis is that South Africa is very dependent on medicines and equipment from abroad, from China, from Western countries and so on. Even the masks that we made, material often coming from abroad. Now this is an opportunity to really look at the economy and say, what can we do ourselves now that we don't have to buy, from other countries? So that's the second pillar of the economy that we have to look at. Then we have to look at third pillar of the economy. What does the world need after COVID-19? What does Africa need? What do we need as a country? Can we build new industries in the sectors that, because COVID-19 has changed the economies, has changed the way people spend, the way people work. Can we rebuild the new part of the economy based on that, the new demand? Then the fourth part of it is, how do we use technology now, to create jobs? Just think about it. Because of COVID-19, Many companies, not only in South Africa, but around the world, will be less and less face-to-face interaction. So they'll use more and more, technology that reduces face-to-face interaction because of the potential spread of disease. Can we create a new economy based on, technology which is less face-to-face? Then, in terms of energy, we still have an energy problem in the country. Can we use renewable energy now? Because in renewable energy, we can also get people who don't have the skills, they can be part of the productive capacity of renewable energy. And then also, lastly, can we focus on manufacturing? We need to produce things in the country.
Okay.
Produce things for ourselves and produce things for the world. And then, our seventh pillar is, we produce a lot of exports, raw materials that we send to other countries.
Okay.
Can we move those, develop those raw materials into value add that produce more wealth, more jobs, more income for people?
Unfortunately, we're out of time, Professor, but just a quick one. The team also flagged a term WASH, which is an acronym for water, sanitation and hygiene. Now, as some of the schools have already reopened and we're still yet to see when the other, the other levels of the education system are still yet to open, then there's the issue of the water and sanitation at some of the disadvantaged schools or the lack thereof. And this has been an issue that has been so endemic in the country's education system. So do you get a sense that the government has a concrete plan in trying to deal with that aspect of dealing with the pandemic?
That is one of our legislative issues. So the government has, taken tanks and so on, to schools and so on. I'm afraid to say that is not enough. We really need a bigger program on two levels. First level is, we need to rebuild the infrastructure. But in the meantime, we need to bring in interim infrastructure. Can we, for example, bring in the army? And the army is, the army has capacity with water tanks and so on at a mass level to the schools. How can we bring in civil society to help, whether it is churches, civil society, to bring water and so on? How do we bring the private sector? Private sector have trucks, logistics, bring it into, and then we have to educate people, how do you social distance in the context? Because it's difficult in an informal settlement, people stand in a queue for water. How do you social distance in their context? It's very difficult. The same in the schools. How do we teach people now, to wash their hands, to be clean when we have water scarcity or when people don't have even water to drink? It is going to be very important that we do much more than we're doing currently.
Okay, Professor Gumede, thank you so much for your time. We appreciate your thoughts and for your reflections. Well, that was Associate Professor at the Wits School of Governance, Professor William Gumede, just sharing with us some of the findings of the first academic review of government's response to COVID-19.